Hello, my name is Carmen Burke and I am here today to read with you and explain the post-op instructions for the extraction and immediate root implant. Please contact us with any questions or concerns. Our telephone number is 303-219-0499 and our email is office@carmenburke.com, and you can also text me to my cell phone 949-394-8031 if you have any questions or concerns. The following guidelines will help you to ensure optimal healing and a successful treatment outcome. So please follow those and it will be really good. And when you come to the surgery, so we will give you a bag with some items that you are going to use at home. So one is a surgical toothbrush. This toothbrush is really soft. It's to brush close to the area where the implant was placed. A double-headed brush to clean the Essex. So you will see it's a little bigger, and then it's just to clean it when you take it out from your mouth. You clean it with that brush. We will give you sterile gauze just to, if you need to clean close to the implant side, we'll give you a nice pack, tooth in a pouch, and we'll give you these post-op instructions print out for you to consult anytime you need to. Minimize swelling with ice and elevation. What we mean by that is you're going to give ice pack. The one that we give you is just one use, but you can have some at home, and you can do it every 20 minutes, every hour, and you can put it in the cheek, in the side that the extraction was done, and also you can do some crushed ice in your mouth. That will promote vasoconstriction because the cold will contract the vessels, and then the bleeding will stop. We're going to place the PRF, which is really good for the bleeding, but still we need the ice. And then you have to sleep for 2 or 3 nights elevated, like you can see here in the picture. The lady has 2 pillows, so your head should be a little bit more elevated than your heart. And then you just take your medications. Avoid bending and inversions for 6 weeks if the procedure was done in the upper arch, because the sinus. So we don't want this pressure will interrupt the healing of the sinus. Moist heat. After the 48 hours that you did ice, so you're going to do moist heat. So the moist heat is you just boil water, like maybe 2 cups of water, 1 tablespoon of Epsom salt, and then you stir it up, and then you have a washcloth, like you can see here in the picture, and then you put it in the water, you drain the excess of water, and you put it in the cheek where the procedure was done. And what you do, you put it there until that washcloth gets cold, and then you put it back, and then you put it until the temperature goes down. That will be really good to improve dilation and circulation, which is really important for healing. Rest is best. So after the procedure, we really want you to rest. We really want you to avoid heavy lifting or exercise, like when you do cardio, when you do those classes that you sweat a lot. So you should avoid that for the first week at least, because we want all the energy that you have to focus on the healing. But then you can, after a week, you can resume. Taking walks is okay and recommended. So just walking is okay, just don't do a lot of sweating and a lot of cardio. And then after a week, you're going to resume really slowly. But then listen to your body. If any workout that you're doing, it feels too much, please stop. If it feels great, if you feel, oh, I feel so good, I like it, please keep doing it. But just please listen to your body. You will need to change your diet for 3 or 6 months, because we will give you the Essex retainer. So the food should be soft, so no fibrous, no hard, no sticky, no crunchy, nothing containing seeds, because the seeds, it goes to the wound and it gets stuck there. And we don't want that. And nothing that requires a lot of chewing, like a steak, something that is really chewy. So you can see in the photo that we have mashed potatoes, steamed vegetables, creams. You can do the bread, but not the crust. Just everything that is middle soft. No straw. So the straw will apply a negative pressure, and then it can dislodge the PRF and the blood clot that is forming. So avoid straw as well, at least for the first month. And no straws, no hot drinks, because remember that it's a wound, but also the Essex can get deformed because if it's really hot. So just try to do lukewarm. That's a perfect temperature. No carbonated drinks, no sparkling water, no sodas, no beer, because that has acidic pH and that interrupts the healing. No alcoholic drinks, those are also acidic, and the gum heals in neutral or alkaline pH. So please avoid that at least for the first month until you come here and I tell you that the wound is closed, that you can do all those things. So when the wound is closed, you can do hot drinks without the Essex, but not before a month for sure. Try to eat only 2 meals per day and have smoothies as a snack. We want to avoid a lot of chewing because we're protecting the implant from micro movements. So if you chew a lot, there is more chance that the Essex breaks and then you touch the implant and then we interrupt that osseointegration, which is the bone growing around the implant. So we don't want to move it. I always use this analogy is when you have wet clay and you put a stick. If you don't move it and the clay dries, it's impossible to take that stick from there. So the analogy here is the clay is the bone and the stick is the implant. So if we let it heal, the bone will grow and stay really firm and around the implant, and then the implant will be really steady. So please, let's do that. It's temporary, but then you will see the results. So it's future gratification. So we will let you know when the one is closed and then when you can change things. No alcoholic drinks, please. No beer, no wine, any cocktail or anything. That just think that it's acidic and that will interrupt the healing, and we want you to heal really well. And you can drink later. It's not that it's forever. It's just for a period of time, just because our goal is that to heal. Pain management. If your health allows, we highly recommend ibuprofen and Tylenol. You can start with no less than 400 because less than 400 is only for pain, but more than 400 is for inflammation. So 400 and 600 of Tylenol, but if the pain is more, please go to 800 milligrams of ibuprofen, 1000 of Tylenol, and then every 6 hours. Don't exceed that dosage because you will exceed 4,000 milligrams of Tylenol and 32,000 milligrams, 3,200, of ibuprofen, which is the maximum. So every 6 hours, those two doses, 800 of ibuprofen and 1,000 on Tylenol is good for the pain. If you feel more pain even doing that, so please let us know. I will recommend another medication. But so far, it has been working really good. If you would like to add arnica, the homeopathic remedy, please consult with your medical doctor before. And yeah, if you feel like it's not working, just please let us know. The inflammation will peak at day 3 and 4, so it's important to be ahead of the inflammation and the pain. Antibiotics, we always get this question, why if you're holistic, you prescribe antibiotics? Because we're protecting your brain and your heart. And we have a lot of practitioners that they are medical doctors, functional medical doctors, chiropractors, and naturopathic doctors, naturopaths, all these holistic practitioners, and they have told me at the beginning, 7 years ago when I opened the practice, they were telling me, no, I know how to manage infections, I'm not going to get antibiotics. So I say, sure, but then they were coming back with secondary infections, and that was not good. We needed to prescribe more antibiotics and stronger. So there was a point that I say, no, we really need to prescribe antibiotics. If you don't want to take antibiotics, we shouldn't do the procedure, because I just don't want to risk your heart and your brain. So we recommend 2 days before the procedure, and then you take it for 10 days, and that will be plenty. Some people need second round, it depends, but usually this is perfect, and the healing starts with the right food, which is really good. Probiotics are really good to take it like in between, if your medical doctor allows that. If you're not allergic to penicillin, that will be our first option because it's really good. It has a wide spectrum for all the microbes in the mouth, so that will be the first choice for us. No rinsing, no swishing, no holding water for 4 weeks. Avoid those. It's crucial to prevent dislodging the blood clot and the PRF in the extraction on implant site. If the blood clot of PRF becomes dislodged, you may experience dry socket. Dry socket is extremely painful, and you will need to return to the office as soon as possible. If the PRF is dislodged, healing will be interrupted. If the graft implant is disturbed, bone formation may not occur. So please, don't rinsing, no swishing, and no holding water is what we recommend. No smoking, no vaping. That is one of the first contraindications and the most important contraindications when we're placing an implant, because the healing cannot happen. Some people say it happened to me, I was smoking and it healed, but it's not the common. So please avoid it. That's the main thing. And no blowing your nose for 6 weeks. If the procedure was done on the upper arch, that is because the sinus membrane needs to heal. And when we blow our nose, we always interrupt that membrane to heal. So please don't blow your nose. What you should do is just clean if you need to clean your nose. And the less you blow your nose, the less demand you're demanding mucus from the sinus. You will see that there will be a time that you don't produce that much mucus. So it's possible. A lot of people ask me that this question, oh, how am I going to do? Remember, if the extraction was done in the premolar and molar area, you shouldn't blow your nose, and it's possible. A lot of people have done it, and it's good. They heal really well. When you need to sneeze, if the procedure was done on the upper arch, just try to sneeze. Don't hold it because that is another pressure in the sinus cavity. But don't do really hard. I know some people do it really hard because they feel more like they feel relief. But please just do it very gentle, but sneeze, just not too loud, because both holding or doing it too loud is not good for the sinus. Brushing, so please avoid electrical toothbrush and toothpaste for a month. What really cleans the teeth is our mechanical action, mechanical movement. So it's the bristles and the toothbrush and what you brush. For a month, we don't want any chemicals to interrupt the closing of the wound, so please avoid those two. You just do you just brush the opposite arch when you have the Essex in place, just normal dental floss, and you're going to dip your toothbrush in water, and whatever water it brings, you brush with that. Don't rinse and don't switch. Just with that, and you will see, and you can drink water too. So that's a good thing, but yes, avoid toothpaste, and you just brush 2 or 3 teeth and put it in water again, and that brings, I have done it, and it really brings good enough water to clean. So avoid the areas that are tender, and please use dental floss and clean the adjacent teeth of the implant. The Essex retainer, so you will use it 24/7. This is really good to avoid the micro movements, so please use it 24/7 to eat, to drink, and to sleep, because we also want to protect the implant with the movements that it can be provoked by the tongue and by the lips and the cheeks when we talk. So we really want that to be protected, so 24/7. Keep it in your mouth for 3 days in a row after the surgery. I know people say, oh, but that's gross, I feel food going there and getting fermented, and it's true, but that also protects the clot. So the clot starts like transforming in bone and in gum. So we really need that clot to be there. So just stay with that. Unless it's very uncomfortable. If it's very uncomfortable, just text us or call us, and I can tell you how to trim it, or we're here, we can help you how to trim it. At the 4th day, only take it out to rinse it and put it back immediately. If just stay there, and if you don't wear it, you can fail. The implant can fail. So eat and drink with that. Avoid chemicals. That's why no toothpaste. And please don't rinse your teeth with lemon water, but you can put some drops of lemon in a little water to brush the Essex with the double-headed brush that will give you. Food particles will become trapped in the Essex. That's normal. We cannot do it very tight because we want the gum to get inflamed, so it needs a space. And when you're healing, we're going to check if we need to change the Essex and do it a little bit more narrow, just for you not to feel that like a white thing that at the beginning is necessary for the gum to get inflamed. Just stop with that, and so that's good. So then we're going to put some sutures. The suture is usually to keep the PRF in place. The membrane, the only membrane that we will place is if you need a special gum procedure or sinus procedure. That's really rare. We have done it maybe one time. So membrane is if we cannot place the implant. And the suture, if we place the implant, we don't place the membrane. And the suture is to keep the PRF in place. Usually it's not resolvable, not dissolvable, and I will remove it in a week, or I will see. So you will have a follow-up in a week, and then I can tell you if I need to take it out. If it's still holding the PRF in place, I won't take it out. But if it's not holding anything, if it's getting loose because inflammation is going down, I remove the sutures. Please don't kiss your pets. And so they carry bacterial infection, they compromise the healing, they increase inflammation, and they weaken the immune response. So please don't kiss your pets. Give them love and attention, but not close to your mouth, please. The required follow-ups are just to check the healing. So it's 1 week from the surgery date, and then a month, and then 2 months, and then 3 months. And then we can tell you when to start eating without the acids and when is the time to do the digital impressions for the crown. We're doing a study with Root, which is really good. I think it's good for everybody to know the longevity of the implants. They have done studies before, but they are always doing studies because that's what people ask. Do you have studies that show that this is a good product, that what is the longevity? So I really like Root because they're very responsible. They want the best for the patient. They have a great product that is very biocompatible and it's really easy to maintain by the patient and to place by us. So I really like it. And so we're doing a study. So we're going to send you a consent for you to sign. Please sign it. Your name will be there. It's just your ID, but it's just for us to see how long, if we have failures or not in 5 years. So it's a really good information that patients and dentists will enjoy. So what are your responsibilities? Schedule, reschedule, and come to your post-op appointments. If you need to reschedule, please call us, text us to reschedule, and schedule also the appointments. If additional follow-up appointments are required, those can be discussed, explained, and scheduled as needed. There is not an additional fee associated with post-op appointments unless we have to do a treatment, but we talk about that. But usually we don't have to do anything. It's just to do things to improve the healing if we need it. If the implant site is not fully healing for months, you will need to come back as needed and prescribed by us. So we're going to let you know if you need to come and why, and we just discuss all of that. So please understand the importance of taking antibiotics, following the post instructions, wearing the SX retainer 24/7, resting, eating soft food, but really nutritious food. So we don't want you to eat only soft food, but they are because it's soft. We want very nutritious because we want to build bone. Cleaning the area properly. Remember that plaque is the enemy #1 for bone, for teeth, for implants, for gum. So we really need to clean that well. Drinking plenty of water and returning to the office regularly for the post-op appointments. So when you're cleaning the Essex, don't go and clean too much. Just a little bit of the first month is just the adjacent teeth and just a little bit with the surgical brush, but not too much because we want that to heal. After that, after the first follow-up, which is the second follow-up, which is a month later, we're going to give you more instructions. Our whole body functions affect the healing of your dental surgery. If it is necessary that your doctor evaluate your gut health, adrenals, neurotransmitters, hormones, etc., to be sure healing will be optimal. With that said, we highly recommend working with a functional medical doctor, naturopath, a naturopathic doctor, nutritionist, integrative medical doctor, etc., for continual support for your body's immune system and to build bone post-dental surgery. If you are without an integrative practitioner and seek one, we can recommend one of our beloved patients who are experts in this matter. They heal themselves and they have helped people to heal as well. So vitamin C, if you're taking vitamin C, just please avoid those maybe 2 days before, just because sometimes people don't get numb when they take a lot of vitamin C. Some don't, so we don't want to take the risk because we want you to be in a painless procedure. A self-care product that support healing and recovery. This is just optional. You can consult with your medical doctor. Please consult. So red light therapy is really good. You can have this. This is in your post instructions, and we're sending you this by email too, just for you to just check the links. There is a package that you can get the ozone insufflation. We don't sell it. These are other companies. It's just a recommendation. You can just read about it, and if you feel good and if your medical doctor allows this, please do it. And Himalaya salt neck wrap is really good for inflammation and just to start the healing and stop the pain. Thank you. So contact us to our phone and our email and let us know if you have any questions. And I hope you have a great healing. Thank you so much. Bye.